The child says, well, I've got Mama's attention. I don't have to do exactly what the doctor says, but just almost what the doctor said. And they don't get it. They don't get it. I think you'll find that that is your main trouble, is the parents in the room. Get the parents out, and you'll find that that situation will improve completely. Doctor, where would you grade yourself?
Well, the trouble I've been having, I think, that I particularly use it most for is trying regression. I haven't been too successful. I would say 50% maybe.
You should be at least 95 to 98% successful on regression. You've got your tapes, haven't you?
Yes.
You've been taking the tapes?
Yes, that was, I was going back to the last tapes. That's the reason I was sorry that I missed part of that last week on that one.
Yeah.
Your method.
Always, doctor, when you're going for regression, and you're in hypnoanalysis, you have to be sure that you establish the belief in the patient that he can do what you're asking him to do. You notice that when I'm working with someone, if it's the first patient up, I will give him a long song and dance about what is possible in this state. In other words, I will tell them that in this state, this is the state in which we can go back and have you relive any episode of your lifetime. And I give him a long introduction. When I say I'm going to take you back to the first grade in school, because that's generally a place where I start if I'm working with something that probably started in childhood, I'll have him believe he can go back to the first grade in school before I have him go back to the first grade. Do you see what I mean?
You give him this instruction in a somnambulistic state?
Oh, yes,
Yes.
yes. And I will never do it before I hit the somnambulistic state, because he will not give credence to what I say. If we're just talking across the table like you, and I say, do you know that I can take you back to when you were taking your first footsteps? Yeah, I'd like to see it. And the skepticism implied and the resistance implied by that remark says you're not going to get any place.
That's right.
But if you wait until the critical factor is bypassed, when in this relaxed state the patient believes anything is possible, anything within human reason is possible, now if the practitioner makes the statement, the patient believes, and believing can do. Do you see what I mean?
I think my problem, it seems to be that I think I have true somnambulism, and I do this and still I don't think I can do that. That's the little thought that keeps it.
Well, if they think they can't do it,
up there,
if they think that they can't do it, doctor, they can't do it. I mean, it's as easy as that. All you have to do is to think no in hypnosis.
That's right.
And you don't have your results. Therefore, I try to get them into somnambulism deeply enough so that anything I say to them sounds like it's quite possible, that this relaxed state will do things that no other state will do. Then you can do it. Now, an awfully simple way to prove somnambulism, doctor, is the technique I used last week. Prove it fore and aft. Before you have them open their eyes, after you have them open their eyes. Prove that the somnambulism is there. Another thing, while we're talking about this...
Now, how do you prove it's there?
Well, didn't you see me do it last week, last session?
Yes, and I think I do the same thing, and then I don't have it.
Well, because apparently...
You pass the test, they'll have post-hypnotic anesthesia and all those, and then when I try to regress them, I don't get true regression.
I won't go after anesthesia or anything like that if I'm doing hypnoanalysis on a person.
Well,
here is my approach to the patient, and you've seen me use it. I am here to help you. Your doctor has brought you here. In your case, you are the doctor. But in my case, your doctor has brought you here to be helped. And if I can help you, I'm going to do it. Now, it is up to you whether I help you or not. If you do as I say, I can't help but help you some. But if you don't do as I say, there's nothing I can do to help you. And if you get that across to them, for instance, when I sent Pat back to his seat a couple of weeks, wasn't this the class that Pat was in? Yeah. When I sent Pat back to his seat a couple of weeks ago, I knew that I was sending a heartbroken kid back to his seat. But I knew darn well that I had to put into his mind the determination that if I gave him another chance this time, he was going to do as I say and not give me any resistance. So when I sent him back to his seat, I softened the blow a little bit by saying, that doesn't mean you can't do it. It means you didn't do it here. Now later I might work with you again if you think that you can do as I tell you to do. And doctor, you've got to be firm sometimes. For example, I'll tell you what I tell the men in OBGYN. And this is so easy to tell a person, although you may not realize that it's easy to tell a person. Suppose I'm working with some OB patients now, conditioning them for an absolutely painless delivery, and one or two of them doesn't go all the way. The rest of them go all the way, but that one or two don't. Do you know what I say to those two? Well, it looks to me like you'll have to have your baby the hard way. And you would be surprised how hard they try the next time and how quickly they get it. Because I thought to myself, if I could have every doctor in the St. Louis class do as Dr. Burpo does when he meets with resistance, they'd meet with a lot less resistance. And that goes for hypnoanalysis or anything else, doctor. The same thing is true. If you hit with resistance, you can't do anything. If I hit with resistance, I can't do anything. Let him just resist me, and I say I'm going to stop working with him instantly.
Well, I can't quite do that.
No, you can't stop working with him. But you can stop working with him so far as hypnosis is concerned. You can do this much, doctor, just as I have done.
I'll have 50% failures if I do it that way.
No, you will not. You will not. When I'm called into a psychiatrist's office to help him with a patient, doctor, it isn't the easy one he calls me in on. You know that. It's always the tough one that he calls me in on, because the easy ones he can handle himself. And so far as I can recall, in all the years I have ever been called into psychiatrist's offices, and God knows that's been going on for the last 10 years or more. More than that, even. I have never failed with a patient in a psychiatrist's office. Now, the reason I do it is just this. I come in, and we'll say that the patient is a suicidal depressive, and that's a pretty tough one to handle, particularly if they're in the depths of the depression as you're called in. And I just come in there with a thought that, well, if you do as I say, we can get you over this depression in a hurry. If you don't do as I say, you'll just have to hold on to the depression. Now, which would you rather do? It's up to you. If you'd like to do as I say, you can get help right here and now. If you don't want to do as I say, there's nothing I can do for you. And my visit here will be just useless. But my visit has never been useless because I am able to put over to each and every one of them the thought that I am there to help them, but they must help themselves as well.
Well, the prestige element there is so great. I don't think I have failed, and I've been called in by another doctor, but in those that I try to, they have a problem. Now, if it's OB, they have a great motive there, but most of these people say, well, what in the hell does what happened to me when I was 3 or 4 years or 6 years old have anything to do with it? So they don't have much of a motive. And I don't have the prestige either on those people because they think of me as a medical man and not a hypnotist.
All right, let me give you the answer to that. Here's the answer that I use. And I've had that same thing said to me. Why, it is going back to when I was 3 or 4 years old. Help me. I got problems. So and so. Sure, you have problems, but you may or may not realize it, that those problems had to begin somewhere. And if we could find out where they begin and find out what caused the original problems, we'd find out what latched onto those original problems. And maybe if we removed the original problems, those problems afterwards wouldn't have anything to latch onto. And all of a sudden, those later problems wouldn't seem nearly as big anymore. Now, that's why we have to go back to the beginning to remove the problem. And I will give them other explanations, such as this. That suppose they're filled with aches and pains of an emotional character, no organic cause for those aches and pains. I'll sympathize with them very much and let them know how deeply I feel. A person has a pain when he says he has a pain. When a person says to me, I hurt, he hurts. And I have keen sympathy for that person who hurts like that. And I will say to him, you know something? There's only two things that can cause a pain like you're talking about. If something physical happened to you, something that, made the cause a broken bone or something like that, or a pinched nerve or something like that, that could cause the pain. But all of that has been ruled out by the tests you've had. So there's nothing that can cause that pain outside of the second reason. And the second reason that can cause aches and pains like you have are the stresses and strains that we go through as we go through life. Now, you may not realize that these things can cause pain, but they do cause pain. When a person talks about a broken heart, it's a broken heart. It hurts. When a person talks about pain in the neck, it's a pain in the neck. We know what causes those pains in the neck, those broken hearts and so on. If we could go back and find out the cause, what put those pains in there, maybe if we removed the cause, the pains would vanish, because they would have nothing to attach themselves to. The pains would be gone. Now, if you want me to help search for those causes, the original reasons those pains are there, then I'm here to help you. But you've got to help me if I help you. You've got to do exactly as I say. Yes, Dr. Burpo.
I know I'm not saying anything new here, but just possibly part of the answer to this problem. As far as my own experience is concerned, I think the compounding and pinpointing are the most exact techniques that I've seen and get you where you want to get faster and with more detail. But if you do find someone who's having a little trouble getting this, I think this television technique or the screen technique, which I wasn't here on those sessions, if you talked to them about that, I don't believe.
I don't know if I use the television technique in this season so much. I've been using so many other techniques, and I think that the television technique is so clearly demonstrated on the records that I haven't used that.
I think if you meet someone who is a little resistant on just the pinpointing and the compounding technique, I think if you really build up a good story with them as you go along, if you make them feel these things and see them, and if you actually have them sit down in the chair, describe that chair to them that they're sitting in, how comfortable they are, and this screen, you describe it to them fairly vividly, and put the characters in there that you want in there and the time that you want in there. I think that kind of, actually, I imagine what you're doing there is really deepening their trance by this description that you're putting in, but it gets them with it. And if you find someone who is a little recalcitrant, I think that works pretty well. You at least get them started. After they've once gotten started, then you can go on. Once they can see, as you said, once they can see it, once they know they can see it, then they can go on and do anything they want to.
That's right. That's right.
But the more detailed, the more graphic, as to the description that you are, I think the better your chances of success are with that type of patient.
Well, you're emphasizing exactly what I did a few moments ago, that when you start with them, be very graphic in your description of what they can do and what the state is capable of having them doing. And then, with all the assurance in the world, take them back to the first grade or whatever it is. Instead of being unsure of yourself when you say, now I'm going to take you back to the first grade, do it with all the assurance in the world that when I snap my fingers or whatever it is, you're going to see the first grade just as clearly as if you were in it now, all over again. And sometimes they won't see themselves so well, and sometimes I will start with someone who hasn't even got somnambulism because I can't even get the somnambulism. All I get is an artificial somnambulism. And I'll start with the artificial somnambulism, but pretty soon they're deeply in somnambulism, because by that time I can take them to any part of their life and have them relive a breakfast that they had 30 years ago or 40 years ago. And they'll even see the very food they had that morning and the very headlines in the paper that day and the date on the paper that day and so on. Now, for example, when Pat saw the examination paper how vivid that was. But that's not exceptional, doctor, when you
Well,
realize...
Of course, you talk about seeing. They can see themselves so vividly. That's not a real regression if they are seeing themselves, is it?
Well, it certainly
They
is.
have to be themselves in
Oh yes. Well, it's not merely a matter of words.
Well,
When they're reliving the episode, it's an abreaction. When they're recalling the episode, it's a regression. You're just taking them back so that they seem like they're 6 years old, but they'll talk to you like they're 40
Well,
or 50 or whatever.
I've been trying to get a hold of that I've been having trouble with. It's not so difficult if you take them back, but you don't get as much material if they are abreacting as you do when they're regressed. And that's the point I was making, that I'm having trouble
Well,
with.
didn't you say that in reverse, doctor? You get much more vivid material in an abreaction than you do in a regression. Oh, in an abreaction, they're actually really living it. They are living it with all its vividness and...
Well, that's regression. The other is return. You use the word abreaction and regression there, so I use it the same way that I thought you were using it. But I call it return when they are seeing themselves. I don't know what you call it.
Well, here's what I call it: recall.
For recall.
I call it recall when they are just seeing these things in a scene, yes.
Yeah.
But when they are reliving,
or
then it's an abreaction.
Abreaction,
Yeah.
regression.
Yeah, you call it return. I don't think the word return is nearly as good. Recall is the word I use. Recall and abreaction are two entirely different things.
Well,
You can bring on. You can.
Abreaction that I have a difficulty in getting.
Well, then let me tell you, then I've answered your question all wrong, doctor. The technique for abreaction is to put it into the present tense instead of the past tense.
Yes, I do that.
Now, wait a second, you say you do that, but let me tell you exactly what I have seen in so many psychiatrists' offices. When they attempt an abreaction, they will vary their tenses, and every time you vary your tense, you return it to regression or recall, and you return it to abreaction when you use the present tense. For example, if you're taking a person back to a breakfast they had 30 years ago, you're just getting up. What are you putting on? Now, if you were using it for recall, you'd say, what was the first thing you put on? You just change the tense. And by changing the tense, you get either abreaction or recall at will. Now, it's a simple device, and you've seen me do it, and it's on the record again and again and again.
I went over the record. I've played
Sometimes
it over 1,000 times. I noticed how well you did that.
Sometimes
I've tried to do the same thing, but I still have a difficulty.
Oh, you will, doctor. Look, you must realize that I have been doing this thing for so many years, and the average man using hypnosis for that purpose of getting a regression has not been using it the number of years that I have been using. And just as you become adept with anything else, you'll make your mistakes, but not very often as you get used to it. You won't have very many failures with regression or abreaction, depending on which you want. You see, I call regression when I take a person back to the first grade and he sees the first grade over again. But when he's reliving an episode in the first grade, that's abreaction. When he's reliving, it's abreaction. When I take him back, it's regression. It's recall. Now, I know that's a very subtle difference, but it's a very important difference so far as I personally am concerned in hypnoanalysis.
I think it's important.
Sure. Well, you do, because you have to work with the very thing that I'm talking about. However, I think practice will do that, and that very trick of the tenses, doctor. Never vary your tense. If you want to take a person through an abreaction, where are you going now? What's the first thing you do? What are you thinking about? And you can bring back the very thoughts that they're having at that particular time. Let's go over here now. How would you say that you're only doing about 50% in regression and abreaction at the present time?
I do everything, and most of them are recalling. to a great extent.
Well, recall will do them as much good, Doctor, as abreaction, except when you get to the crucial point, there's where you want abreaction. You want abreaction on the traumatic experience, because if they vomit that stuff forth, that's when they're really helped. We had an experience in Indianapolis where several of the psychiatrists from the state institution were there, and this man had terrible chest pains, and they could find no organic cause for the chest pains. Now remember, they were working with psychotics and all that sort of thing, but here I was working with a man who had a strong neurotic manifestation, is what I would call it. He gets these chest pains, and they are so violent that sometimes he faints from them. That's how bad those chest pains are. And naturally, he thinks he's dying, he thinks he's got heart trouble and everything else at the time that this happens to him. I took him back through an abreaction so vivid that the head of the state institution had never in his lifetime seen an abreaction so vivid as this, because the man got up and just went through the actions just as though it was right then and there. And when I saw him go through that violent abreaction, I didn't stop him. And I saw the horrified look on this doctor's face, the psychiatrist's face, when I didn't stop the abreaction. I said, no, let him have all of it. Let him live through it again. Let him vomit forth this stuff that's been poisoned to him for so many years. Watch how good he feels afterwards as a result. Well, he got the stuff out of him, doctor, this violent abreaction. And I made the statement then, I said that I never in my life have I seen an abreaction which was not good for a person to get this poison out of their system. And once the poison comes out, then they get well. And I said, I'm letting the poison come out, and I'm going to let all of that poison come out. That man hasn't been sick a minute since the night we did the hypnoanalysis. Now, all I can tell you is that the 3 psychiatrists from the state institution that we were coming back there, they wanted to be members of the course because they'd seen something that they'd never seen in all their years at the state institution. The reason I'm telling you this, doctor, is that when I want an abreaction, I am able to bring one forth by change of tense, and that is the only technique I used. I will say this, that I have never seen an abreaction which was not good for a person. Now, I will say this much, that occasionally, the abreaction for about 2 days, it will seem to have a bad effect. You know what I mean? They will seem not to be helped too much. But about 2 days later, then comes the recovery.
Now, the ones I've worked with, I thought have done well immediately.
Well, I have brought things back which were so troublesome, things that I can't even mention in this class because of the fact that we've got youthful members here. But I have brought things back which were so troublesome to the patient that having them live through it so vividly was in some ways punishing to them. But when they saw that this was the poison, about 2 days later, then came the recovery. And this much I have seen, and I've had this reported to me by various psychiatrists in whose offices I've worked, and who themselves have had this experience. So I want you to know that sometimes that will happen. But let's go on to other phases of this. Doctor, where would you grade your own success? Where would you put your own success? Or your own mark? We'll say, grading it on your ability to use the knowledge and your ability to absorb the knowledge. Where would you grade yourself?
Well, I think I've learned a great deal, and I think even each week I keep improving a great deal. And that's especially when I look back at the time we started the course.
Mm-hmm, mm-hmm.
Of course, we all try to compare ourselves to your ability, and I think that's where we realize that we don't have near your ability. But looking back at what I learned new even 6 weeks ago, I think it's been a great help to me.
Well, I hope so. Incidentally, how are the eyes and so on?
I had some trouble this week.
Did you? Yeah. How was it first?
It didn't help as much as the other time.
Didn't, huh? Yeah. We didn't have to cause that. We thought we did. I thought we'd hit it. There, now look, I want you to know something. Here is what hypnoanalysis will do. You hit the wrong thing, you won't get the help. So many times we think we've hit it, and certainly you and I thought we hit it, didn't we? The doctor has been troubled with a conjunctivitis, is that what you would call it?
Sinusitis.
Sinusitis and the conjunctivitis combined, isn't it? For ever since he was a knee-high to a duck. We took him back to an episode in his crib and thought we had hit the cause because he could actually feel the episode right then and there. Isn't that right? That was what we would call an abreaction. And he saw himself right there having that episode all over again and could feel the fright that was caused by the episode and how the crying was caused to stop by the fright, the panic that seized him at the moment that this thing occurred. And we thought we had hit it. Oh, I was so sure when we got through working that we had done it. We had gotten to the actual cause. Now, proof that I did not do the job is the fact that he isn't completely well from this situation. If I had hit it, he would have had a complete recovery. I didn't hit it. Or I hit it partially, do you know what I mean? But didn't cover it completely. Don't think that just because you see me using hypnoanalysis with apparent knowledge that few men possess, that I don't make mistakes with it. And I can make mistakes just as easily as anybody else. And I can try awfully hard and still make a mistake. So, doctor, if you can help 50% of your neurotic patients, it's
may I
pretty
ask
good
a question on that?
Yeah.
Were you seeing yourself in the crib, or were you? No, but I felt, you felt like you were you the child in the crib? You felt that you were that age and you didn't know anything from then on? Or were you watching this? It's hard to explain, but I had a feeling of fear when this thing... Yeah, you have a feeling of fear in these recalls, you have a feeling, but you're not regressed in my estimation, and what I get in that state, I get a lot of fanciful stuff.
No, you don't get... No,
and if he doesn't
no, he was really reliving it. He was really reliving it because he could feel the jar on the crib. Isn't that right, doctor?
But
you could actually feel.
You can imagine those things too.
Oh no, he wasn't imagining, doctor. He was feeling the jar on the crib when this person had come up and he was crying as a baby, and somebody had come up to his crib. And in an effort to stop the baby crying, he was only, I don't know, less than a year old, I guess, at the time this happened. And here's this baby crying because the baby's uncomfortable about something. And somebody comes up without telling him and suddenly jars the crib. Well, it panicked the kid to the place where he was silent. But the crying was still there, and I felt that this was an expression of the fact that the crying below the level of consciousness had not stopped, but that consciously it had stopped. In other words, there's a crying that goes on below the surface of awareness, which is responsible for many conditions in my estimation.
Well, I have found this out, that in working those cases where they're looking at this and getting the feeling that you don't get the results that you do if they are actually regressed or abreacting. Now, he doesn't seem to know whether he was the
That's
baby or
because of the amnesia, doctor, that is associated with the state. But I assure you, when I tell you that he abreacted and actually felt the jar, and I could see him feel the jar. I could see him go like that. And if that isn't abreaction, I don't know what is.
Well, you can get that without abreaction. Unless I'm wrong in my...
You're wrong. You're wrong in your opinion. I'm sure of that. Because you only get it when there is an absolute abreaction. And then he told me afterwards of the fear that he felt when this person had done that. And many years afterwards, when the person reminded him of the incident, which he had completely didn't remember, have any recall at all about, that he felt very angry that that person had stopped his crying that particular way. And he didn't know why he felt angry. He just felt angry. Isn't that right, doctor? I thought I had hit the cause. Well, apparently I didn't hit it completely enough, or all signs would have vanished, which means that further work is indicated. That's all. It doesn't mean that the that the case can't be solved.
I'm not